Golden Dent.
Hi everyone, it's Courtney from Golden Dent. As you all know, we haven't been doing very many trade shows or events, so we wanted to get out some demonstrations of a couple of our most popular products, so let's go ahead and take a look at them. The final product we're going to talk about today is the WAMkey. This is a great product for removing crowns and bridges. So the first question we always get asked is, does it work on bridges? It absolutely does work on bridges. The most common places that it will work best is the posterior region. So if you have a patient that comes in and let's say one abutment is loose, the other side is still cemented on, what you would do is you would go ahead and work on the tooth that's still cemented on to go ahead and break that bridge free, and then you can go ahead and assess to make sure there's no damage and go ahead and re-cement. So basically with this instrument, how it works is you need to find the cement junction of where that tooth is cemented on. So it's a little bit challenging sometimes, but we always recommend to base it on what type of crown that you are using. So if it's a PFM crown or a gold crown or a stainless steel crown, that would determine how far down you go. Usually we stay in the occlusal 1/3. So you'll make your small opening, you'll go ahead and look in, see if you can see the cement junction. If you can see that, then what you'll go ahead and do is use the underside of the crown as a guide, and you want to drill all the way into the center of that prep. It's very important to get into the center of this prep because that's where you get your greatest force to push the crown off. This is a very large demonstration model, so you can kind of see, but basically what you do is you go ahead and insert the key and you twist with this. It's a very common question that we get from a lot of doctors is, do I twist with it? Do I push with it? Do I pull with it? What do I do? So make sure that you twist with it. It's not designed to take any wedging force. You don't want to do that because that could potentially break the instrument. Another common question we get is, this is the actual kit. There's 3 keys in this kit. Why do I need all 3? So if you can see, I'm not sure if you can see it, but there are different sizes of the keys. So the number 1 is the smallest one, and then they kind of go up in size. So we always would usually recommend to start with the number 1 WAMkey, and then if you need to move up in size because you've either drilled the hole a little bit too large, there could be a little bit of decay or an amalgam core underneath this area, and that would cause the key to basically just spin inside the hole and get no torque to push the crown or the bridge off. It would just spin. Lots of doctors like to go ahead and remove crowns for doing any type of root canal treatment, so this works perfect for that. You can go ahead and reuse the crown if you want to, as opposed to drilling into the side of the crown or the drilling the whole crown off and having to take the whole thing off and destroy it. So that's a very nice option for this instrument, is that you don't have to completely destroy the crown. You can go ahead and pop this crown off, do your root canal treatment, and go ahead and re-cement, and then all you have to do is patch this small hole here.